Hello everyone and welcome back to the Diary of an Endodontist. Are you still thinking in two-dimensional? That's what we are going to discuss today. Stay with me. This upper left second premolar was referred to me, and as you can see there is a metal screw retained post with defective margins and defective root canal treatment. So what we are going to do is to check in the x-ray. First of all, if there is any apical radiolucency, and it looks like it has one, and the post, if it's centered. Pay attention where the arrow is, and you will see a slight radiolucency, which is unilateral, so it's more towards the distal and not extending to mesial. Could it be a crack? Yes, it could be, but more likely to be something else. Do you know what it is? Well, unfortunately, because of the severe decay, the gross caries in this area, we had to extract that tooth, but not because of that radicular radiolucency. It was just because the tooth wouldn't be able to take a new post, a new crown. It would have failed very soon. There was a small crack line going into the post area, so we thought that it wouldn't be worth treating it. But if you think about the post, was it positioned centrally like it looked like in the previous x-ray? Or remember that the x-ray only shows mesial and distal. And what we need to think about is in three-dimensional, because we always have the buccal and the palatal aspect of this tooth. So although it looks centered in the middle of the mesial and distal, it was not. So when we removed the post, we could see that the angle of that post was towards the buccal, and that radiolucency just confirms what we expected. It's a buccal perforation in the mid-third of the root, caused by the wrong angulation of that post. If you ask me, is it possible to repair this sort of perforation? Yes, it is possible. Once you remove the post, you can fill that and repair the perforation with bioceramic. However, as this tooth was coronally compromised with gross caries and also a small crack developing, we discussed that with the patient, and the patient decided to have that tooth taken out. So be careful with conventional x-rays only. For correct diagnosis, you need to think about lots of factors. And if you have the availability to have a 3D scanner, is much better, because the two-dimensional will be restricted to show you mesial and distal, whether the three-dimensional will show you the whole tooth, the walls of the tooth in all directions, the bones surrounding it. So it removes all the artifacts created by landmarks on the 2D. So I hope you have enjoyed that, and I hope you have a different view now when you see a case like that. Thank you very much.